You see here on this graph, 1.8 million people have been tested in the state of California. And what is so important, as we test exponentially more, 20, 30-fold more than we were just 8 weeks ago, that when you are testing 20 to 30-fold more individuals, you're going to have more positive tests. That's an inevitability. And that's why it's important, it's incumbent upon those reporting that we also report the positivity rate, which is the percentage of people that we've tested and the number of people as a percentage of that have tested positive. We've been running a positivity rate over the last 14 days, and you can see the substantial increase in testing, specifically over the last 14 days, of roughly 4.1%. It's about 4.2% just over the last 7 days. That's an encouraging number. That's a relatively stable number, and it's a much lower number than many states. Not every state, but many states. That's a number that's incredibly important when we talk about the issue of testing. I've seen the headlines around total number of cases increasing, but equivalent consideration, at least a subtext of any headline, should also include some stability to the extent that's reflected in our numbers in terms of the positivity rate. The issues, though, also need to be highlighted related to testing around race and ethnicity. This, again, connects the dot that I'm referring to. We talk about testing. It is incredibly important that we test our diverse communities in the state of California. As you all know, we have made real progress and made real commitment, and we are resolved to do more and do better to reach out throughout the diverse communities in the state of California, not just in inner cities in this state, but in rural parts of the state of California. You can see by the increased number of tests, you can see some trend lines that have legitimately and understandably become headlines all across this country. And that's the disparity in race and ethnicity in terms of the total number of positive cases and the total number of deaths in the state of California. This is manifest all across the United States of America. In some ways, our numbers are more in line with population. In others, we are not immune to those disparities, again, that were brought into this crisis in the first place. You can see for the Latino community, 55% of the total number of positive cases we've identified within the Latino community, roughly 39% of the deaths, which is roughly in line with population on the death sides. Asian community, relatively consistent on the death sides with population, but the Black community, again, not surprisingly to the theme frame that connects the dots today, 5.3% of the cases tested positive, a little below state population, but the number of deaths substantially, in percentage terms, substantially higher in the Black community and the African American community. And so it's a point to highlight, and it's an incredibly important point about the structural challenges that we have as a state and a nation to address the issues that we brought into this crisis and to subsequently address to resolve these issues once and for all. And so, Dr. Ghaly, talk a little bit more about that. We're happy to answer more questions about why we think that's the case as it relates to comorbidities, when it relates to issues of hypertension and issues of diabetes and other related issues. Issues is also related to food deserts, all kinds of socioeconomic issues that we believe are part and parcel of this, as well as the nature of essential work in the state of California being overly represented by people of color in this state. All of those things lead to an understanding, a more granular understanding of these numbers, but these are the systemic numbers that predate the incident, this tragic death of George Floyd, that fundamentally are being highlighted at this moment of protest, consternation, hurt, and protest across this country. As it relates to the issues that also extend the narrative of consideration on reopening and have a component that also reaches into the frame of cultural competency. It's the issue of contact tracing. I made this point a few weeks ago. That's one thing to test. We also now, as we reopen our economy, must be able to contact individuals that have tested positive and make sure that those they've come in contact with that could test positive are contacted in a very secure and private way. The state of California came into this pandemic with roughly 3,000 tracers that existed throughout the state of California, doing TB tracing, measles tracing, hepatitis tracing, HIV and AIDS tracing. We committed to developing a workforce in partnership with UCLA and UCSF. We announced that. We've been training a cohort of individuals. We announced a partnership with Salesforce and Deloitte and Amazon to help us with the database, to collect that information, and to share that information across county lines up and down the state of California. It's important for folks to know, as we've increased our testing significantly, we also are on track to our goal of 10,000 tracers trained in a workforce by the end of next month. We've got cohorts being trained every single week, hundreds and hundreds being trained every day that will be part of this tracing core. And we have absolute confidence by July 1st that that first phase commitment of 10,000 workers will be established. You can see on this slide that that 10,000 allows us to trace 3,600 new cases per day. Giving you a sense, yesterday we had about 2,189 new cases. So we have a threshold of confidence that once we have that tracing core up, that first phase, that we will meet the substantial needs of the counties that are reopening, that have to commit as part of their attestation for containment plans, their ability to trace appropriately, isolate and quarantine individuals so that we could keep a lid on the transmission of COVID-19. But the tracing has a component as well. We announced last week, and I just want to highlight this, the cultural competency in terms of our outreach to our diverse communities on tracing. Because it goes without saying, right now we're living in a world of anxiety on many different levels, including anxiety for our Latino community and those in mixed status families that are very fearful around the rhetoric of deportation and the rhetoric, the xenophobic rhetoric that is so much part of our national discourse, particularly over the last few years. And so it's incumbent that we have a tracing core that looks like our communities, and we have trusted messengers that can make those phone calls and want folks to know, particularly in the Latino community, but more broadly, all across our diverse communities, that when we call to reach out, these professionally trained individuals, they're doing so with not only your public health in mind, but your privacy in mind. It's foundational. And so we have a lot of PSAs that we've been putting out in this space, and I want folks to know we're making progress. We're fulfilling our commitment in this space as well, and we're doing it with an eye on representing all of our diverse communities in the state of California. Issues of personal protective gear are foundational in terms of our effort to reopen our economy safely and with an appropriate pacing. It is just a very important point of emphasis that folks know that we have made huge gains. And when I mean huge, I mean in the tunes of tens of millions of units of new protective gear that are part of our state inventory that didn't exist even 3 weeks ago. We were able to get a very large contract overseas that has allowed us to procure tens of millions of procedure masks, surgical masks in the state of California in the recent weeks. Our current state inventory, take a look at those numbers. You haven't seen numbers like this in the past. 85.9 million procedure masks that are currently part of our state inventory, 8 million face shields, 5.6 million glove sets that are part of our state inventory. Those numbers are good on one level because they're ample. On another level, I want to see those inventories decline because I want to get that inventory out all across the state, and that's exactly what we've been doing. Take a look at this. Our procedure mask distribution by sector, just as a proxy for our distribution. 44.3 million procedure masks have just been delivered in the last 14 days. This slide just represents the last 2 weeks. You could see by sector, getting into the agricultural community, getting into hotel and lodging, getting into local government, obviously committing ourselves to social service agencies and public safety, looking at the emergency sector, medical sector, but even beyond that, the retail sector. So we're getting those masks out there, which allows people to protect themselves, to protect others, and open more confidently within the framework of the guidelines that we have put out. And so real progress in this space, millions of masks coming in on a daily, weekly basis, millions more getting out as quickly as possible. But this is important for folks to understand, that we understand foundationally that it's testing, tracing, and the capacity to distribute appropriate protective gear that is foundational. Accordingly, it's foundational. We protect our most vulnerable populations. Remember, these were all part of the 6 indicators that we put out a few months ago that guide our decision-making: data, indicators, science, health, that continue to drive our decision-making. We talked about one of those indicators being our capacity at the county level to protect vulnerable populations, nursing homes. Our surge capacity, you can see we've got hundreds of new beds for our surge capacity if we need them to isolate patients. We have 798 individuals that are trained in a new workforce that can go out like a strike team if we have workforce shortage, or we have a walkout, or we have a number of staff and cohort of staff that have been tested positive in a skilled nursing facility or another licensed facility, our ability to move quickly. We've got that core of infectious disease experts that have gone out, these strike teams in partnerships with the VA, partnerships with UNS Mercy, partnerships with the National Guard, all focused on protecting the most vulnerable, our seniors, particularly those in our nursing homes. Project Roomkey, I'm so proud of this. Just 8 weeks ago, can you imagine a state in just 8 weeks being able to get 9,397 rooms made available for formerly homeless individuals? By the way, 9,397, not the total number of people in those rooms. Those are the total number of occupied rooms in a portfolio that now has exceeded our goal of 15,000. So 60% of folks are already in those rooms, off the streets and out of shelters. Unprecedented in this state's history. I don't know another state like claimed to getting 10,000 rooms, almost 10,000. Remember, we put 1,000 trailers out, 1,305 in addition to the rooms available to cities and counties all across the state. What's really important about that occupancy rate is there is a subtext on that. 78% of the rooms that were set aside for asymptomatic clients and those that needed the support of isolation, we have occupied, close to 80%. Those that have tested positive, we have a larger cohort of rooms that are set aside that are not yet occupied. And in some respects, that's a good thing, because the total number of positivity cases out in the homeless sector have not been as acute as some of the earlier projections. But we're not out of the woods. We're not naive that we're getting all the tests out there by any stretch. I'm not naive about the criticism of needing to do more and better. I acknowledge that. We will do more and do better. But I am so proud of a first-in-the-nation program where we can lay claim to getting thousands and thousands and thousands of people off the streets in just a few weeks. And I want to just compliment our team for incredible work in that space. 50,000 rooms. Remember, we made a commitment. We have to have appropriate hospital surge capacity. We decompressed that hospital system, incredible partnerships with 416 of our hospitals up and down the state of California, working with the Hospital Association, working with small, large hospitals and systems. And they were able to identify a surge capacity of 50,000 rooms. That's check off that exists. Our capacity, our understanding of how to utilize that inventory is also foundational, our ability to reopen this economy and do so in a safe, judicious, and phased-in approach. Again, one of our leading and critical indicators. And that's on top of the stabilization numbers that now we want to, well, transition to and talk about briefly before I bring up Dr. Ghaly. We have seen trend lines for weeks and weeks and weeks, well beyond just 14 days, where hospitalization rates have remained fairly static, actually declined modestly. ICU bed utilization has been fairly static over the course, declined in the last 24 hours, 1.3%, hospitalizations by 2.3%. The point, though, is that line over the course of many, many weeks is stable. And within that frame of stability, again, gives us confidence that counties can decide on their own pace what's best for them in terms of their reopening plans. Again, these are aggregate numbers. Counties don't live in the aggregate, and I will talk about that in a minute, but they are encouraging signs nonetheless in terms of the work that's been done in this state to address the spread and suppress the transmission of this virus. We put out sectoral guidance, also have supported the regional attestations. The sectoral guidance have included over 17 sectors of our economy that can reopen. And we expressed in that guidance how we can safely reopen the economy. We didn't say when, we said how. The when question is determined by local health officials. The state puts out the guidelines by sector on how to safely reopen. It's the counties working with their health director that could determine the pace of when. The state is not dictating, is not mandating those dates. It puts out the sectoral guidance and allows for a deliberative process to be put into place by counties. And that's why you see variation up and down the state of California. Some counties, not all, in the Bay Area as an example, that are moving a little slower. Other counties that are moving a little bit faster. It's exactly the system we designed over the course of many, many weeks. And it's exactly what we encourage. What works in Lassen may not work in other parts of the state. What works in Kern may not even work nearby in Tulare County. Each county has its own unique conditions, and localism, again, is the foundational principle to which we determine when to attest to the local plans based upon local leadership guiding the decision of when to reopen. Again, we put out the how, counties decide when. So here's where we are, and here's the long-winded point I wanted to get to today before I turn it over to Dr. Ghaly, is that big part of the phase that we're in the state, now as we're moving into phase 3, we are not ready for phase 4. I'll just briefly remind you, phase 4 is concerts, big outdoor stadiums and sporting events, festivals, and large conventions. We're simply not there. There's no sectoral guidance that's been given. There's no authority for local health officials to move into that phase. But into phase 3, on their own pace, we are allowing local decision-making to go into effect. But it's conditioned on plans that have to be attested to by local county electeds and local health officials, and through a process of engagement with the state of California, our Department of Public Health. We put those plans on our website, covid19.ca.gov, and we actively monitor those plans. And when there are issues, we target support and engagement. Let me be specific about this and highlight just a few examples. Imperial County. We have been working with Imperial County for the last few weeks. They saw a big increase in hospitalizations. They had some cross-border issues that needed to be addressed. We brought out our DMAP teams. We brought out our National Guard. We brought in HHS officials, not just from the state of California, but in partnership with the federal government. We brought resources to bear, including field medical stations, so that we can decompress, reduce the total population in their hospital system, and get them into these temporary facilities, including the addition of more ventilators. By the way, we have roughly 11,000 ventilators within our system right now that are currently available to be targeted if there's flare-ups or needs across the state of California. So we're doing targeted engagement. We did it in Kern County recently around skilled nursing facilities. We did it in Tulare County with OSHA, and not just our health officials related to some issues in meat packing facilities. That target engagement is part of a very deliberative process of engagement based upon flare-ups, based upon hotspots, based upon areas that we are monitoring in real time with constant collaborative spirit and engagement with local officials. And that's why I just want to remind everybody, as I now transition, that if we see through the process of target engagement numbers that persist and things that get out of control, we will direct the local health officials to put a dimmer switch back on and begin to toggle back, put the brakes on in terms of the modifications and the stay-at-home orders. You saw exactly this up in Lassen County. To Lassen County's health director's credit, they saw a little bit of spike, relative numbers, relatively few, but for Lassen, a relatively large number, considering the total population. They made some targeted adjustments. They did more testing, they did tracing, and they began the process of making modifications back and forth. This is part of the process that we're in. And so the reinstitution of interventions is that third key of counter monitoring that is foundational. But again, all of this is done with local public health officer using data to decide what's appropriate for them. We are not mandating a pace for opening. San Francisco just announced, their mayor, that on June 15th, in 2 weeks, they will move forward. They're afforded the opportunity to go sooner. They, because of local conditions, chose to go a little bit later. We, again, encourage that. San Mateo wanted to move a little faster than other parts of the Bay Area, Marin than other parts of the Bay Area. Again, local public health officers using data will decide the appropriate timing for these openings. And we, again, think that is a foundational principle that you will hear over and over again that is reinforced in three simple words. Localism is determinative.